Hi friends, it's Wendy York, and we're in the middle of this coronavirus crisis together. And some of our families are facing or being confronted with a decision, a difficult decision to place a loved one in an assisted living facility. Maybe it's your spouse or parent. And it's to the point now where you're having to confront that decision of, do I put my loved one in an assisted living facility? And so this video is designed to give you some information and suggestions for you to consider. The first is, if you have a living space, a home that would allow you to have a live-in caregiver, where you can ensure that that live-in caregiver is sheltering in place and not increasing risk of coronavirus being brought into your home, consider a live-in caregiver. And with the unemployment rate spiking, there might be more talent available to you than there otherwise has been in the recent past. But if that's not an option for you and you still need to place your loved one in an assisted living facility, these are the questions I'm giving you to ask that facility to ensure it's a right fit for you, because you have two goals. One, to keep your loved one safe during this coronavirus time period, and also two, to prevent your loved one from suffering a decline from social isolation or lack of activities in a facility during this time frame. So here are the questions you should be asking a facility during this coronavirus crisis. 1, what is their infection control practice in place? Do they have some system of monitoring staff as they come into the facility to ensure that they have not been exposed to coronavirus or have any fevers or symptoms? 2, do they have enough supplies to give their staff protective equipment such as face masks, gloves, gowns, for their staff to keep both the residents and staff safe? 3, what are their staffing levels during this coronavirus crisis? Have they been increased to ensure that all residents get the care they need? 4, what type of social activities can the residents experience during this time period to ensure that your loved one is provided enough activity and stimulation so they don't suffer a decline? Are they giving them one-on-one attention, which would mean that they would need to increase staffing? 5, what will the facility agree to make sure that you, the family, can stay in contact with your loved one if you were to admit your loved one in the facility? Will they agree to daily Zoom meetings or FaceTime chats, because your loved one will most likely need help to be able to FaceTime with you? Will they agree to do that on a daily basis? And what other plans do they have in place so that you could be communicating with your loved one on a daily basis, either FaceTime, Zoom, and then of course visiting through glass to ensure that you stay connected? So those are my questions that I would ask of a facility, and I hope that you consider during this difficult time. So be well and be safe.